This presentation includes the results from an empirical study on a newly designed stress assessment by Ashley Spickler for the School of Behavioral Sciences at Liberty University. During this presentation, we will go over the introduction, the variable identification for the study, and the previous measurements that will be used to compare the results in the study. And then I will touch on the method with the participants, the materials, and the procedure used during the study. And finally, I'll go over the results and the discussion with a score analysis, comparing the validity and reliability of the study, and a discussion of what the results mean. The author created an assessment to quantify the variable of stress, which is objectively defined as the presence of maladaptive, behavioral, physical, emotional responses to the perceived pressure of any internal or external or environmental factors and the impact that they have overall on a respondent's functioning. This is based on empirical research that shows that there are many different types of stress, including chronic stress, life events, traumatic events, daily hassles, and acute stress, and that these can impact an individual's overall functioning in different areas in their life and physiological symptoms. However, the presence of adaptive beliefs and self-compassion can mitigate the responses of the stress and the impact that it has on functioning. So this study will also identify any current coping strategies and support systems that are in place for addressing the stress in a respondent's life. The author used a previously established assessment, which is the perceived stress questionnaire, to validate the results of this study. The PSQ measures stressful events and the impact on functioning for respondents, and it was normalized with a group of 230 subjects that are both in and outpatients, students, and healthcare workers. The PSQ shows high test-retest reliability, and it was validated with trait anxiety, other stress scales such as Cohen's perceived stress scale, and stressful life events. The following charts show the demographic makeup of the participants in this study. There were 67 respondents who completed the assessment for this study. The gender was primarily female. Employment, most of the respondents were employed full-time. However, there were a percentage of respondents who were part-time or students and a few that were not currently employed. The majority of the respondents were married, and almost all of the respondents were of white ethnicity. The materials used in this study included a 3-part Google form that the respondents used to complete the assessments. The first part included the demographic information. The second part consisted of the perceived stress questionnaire, which included a Likert scale from almost, which would be a score of 1, to usually with a score of 4. Higher scores on this assessment indicated higher levels of stress. And the third section consisted of the newly designed stress assessment, which included a 6-point Likert scale with a score from 1 strongly agree to 6 strongly disagree, with higher scores indicating higher levels of stress. Participants were recruited for the study through the author's posts on social media, including Facebook and Instagram pages. The 67 respondents completed the 3-part Google Doc, which included informed consent and a description of the study. The responses were then scored according to the assessment, with some items being reverse scored in accordance with the coping skills and adaptive beliefs. The responses were then converted to an Excel file with all of the demographic data coded, and then a stress index was determined for each of the assessments, and the data analysis was performed to assess the split half reliability and the convergent validity of the new assessment. As you can see, the distribution of the total scores on the stress assessment followed a normal curve, which was similar to the normal curve distribution that was found on the PSQ for these respondents. A Spearman-Brown reliability coefficient was performed for the stress assessment, taking the odd and even halves of the stress assessment for each respondent, and this gave a score of 0.865, which indicated a high internal consistency for this assessment. Validity results were also assessed by comparing the PSQ and the stress assessment, which indicated an R value of 0.827, which was significant at the 0.001 level, which indicates a high convergent validity for the stress assessment when compared with the PSQ. The results of this field test indicate that the newly designed stress assessment is a valid and reliable assessment to measure respondents' stress levels when compared to the PSQ and split half test reliability. One of the strengths from this study is that it was developed with both empirical evidence and the author's professional experience in the field of counseling. However, a weakness of the study is that the sample was not very representative and they were recruited through the author's personal Facebook page. For that reason, further analysis should be done to validate and generalize the results that were found in this study to indicate if this stress assessment can be used in the future to measure respondent stress. If so, this assessment could be productive in treatment, in measuring stress reduction techniques to see if they were effective for participants. Below you will find a list of references that I used in completing this study and discussion. If you have any questions about this study and the results of this assessment, please let me know. Thank you for watching.